Hello, Professor.
Hello, Elena.
As you know, there are a lot of patients with Klatskin tumors. These patients have cholangitis, abscesses, metal stents. I know you're really busy with this topic, but instead of giving information, I actually want you to just vent a little.
You figured me out, Elena, really. When it comes to Klatskin tumors, all I can do is vent, honestly. I've repeated it 1,000,000 times, but we just can't get it across. And I think the reason I can't explain it is this. If you explain what's already known, people get it, but when you talk about something unknown, it turns into, what is this guy even saying? Klatskin tumor is the name of the tumor that blocks the bile ducts at the point where the bile ducts at the exit of the liver merge. That tumor in Klatskin tumor is a stromal tumor. The tumor at the exit of the bile ducts, its histological structure, its biological makeup, its cellular memory is slow. Its stromal bistroma is slow. Sometimes, it takes up to 2 months for one cell to become 2 cells. It takes 4 months for 2 cells to become 4 cells. The time it takes for 4 cells to become 8 cells is 6 months. So, if you calculate this stromal, slow-growing tumor in terms of a human lifespan, the time it takes for a Klatskin tumor to grow to 2 centimeters and block the bile ducts can sometimes take 2 years, sometimes 3 years. For that tumor to grow from there, invade the whole body, all the organs, and ultimately cost the person their life, it could sometimes take 200 years. 200 years. Because when you calculate the growth rate, that's what the math says. It's not my opinion. I mean, for a Klatskin tumor to reach, say, 10 centimeters, it would never reach 10 centimeters in a lifetime. For it to reach 10 centimeters, it can sometimes take 200 years. Of course, reaching 5 centimeters might take less time. You would never see a 10 centimeter Klatskin tumor, except for the mesothelioma type. I'm not saying this for cholangiocellular tumors. What about a Klatskin tumor that involves the hilum? But unfortunately, the moment someone says Klatskin tumor, all the specialists immediately think bile duct cancer. Oh God, we're doomed. It's bile duct cancer. Let's get scans done as soon as possible. Let's get PET scans right away. But even if you do 1,000,000 PET scans, it's very unlikely to find distant metastasis. Maybe there could be lymph node involvement, and that's mesothelia type. Well, in the periductal type, it never happens over a lifetime. Stroma periductal type. You need to know the types, especially in Klatskin tumors. There are 3 types of Klatskin tumors. Mesoforming, the mass-forming type. This one is dangerous. It really grows fast. It can take someone in 6 months, even within 3 months. Let's move on from that. But as I said, in the periductal type, it never reaches 10 centimeters. Even in a lifetime, reaching a 10 centimeter mass could take 200 years, really. I'm exaggerating, just so it sticks in your mind. I hope my other colleagues don't see me here, In the intraductal type, those papillary ones, they're inside the duct anyway. These people rush to get a PET scan right away. Go ahead, but when they get the PET scan, they won't see any signal anywhere. Don't see it. Then they just hold on. With the RCP, we're going to take a biopsy with a brush, but the periductal type is already hard tissue. How are you going to get a biopsy sample from that? Go ahead, do ERCP 100 times. Then they insist on taking a biopsy with a needle, because with a tumor, you need to take a biopsy to prove it. They stick a fine needle 3, 4, 5 times. They insert a trocar, trying to take a biopsy right at the hilum of the bile ducts, where all the vessels are, but they can't make a diagnosis. Because you can't get a diagnosis, you can't get cells from there. Meanwhile, the bile ducts got blocked. After the bile ducts got blocked, while doing the RCP, cholangitis attacks started. The patient started having chills, shivering, and fevers. Delirium started. Things started to get even more complicated. Honestly, it's been 2.5 months for the patient. It's been 3 months. There's still no diagnosis. Let's say, with great difficulty, we finally made a diagnosis. Then, before even discussing whether surgery is possible or not, someone had already made a decision. You can never have surgery. Who made this decision? not a surgeon. Maybe a gastroenterologist, or perhaps an interventional radiologist. Oh no! And then he went to him. After that, especially while inserting catheters, and particularly after the RCP, an abscess formed in the bile ducts. The patient experienced chills, shivering, loss of appetite, and so on. I'm not even mentioning the bleeding and all that. Then they examined the patient again. No, you can't have surgery because your vessels are right there, and so on. Third month, fourth month. Then they inserted 2 or 3 catheters through the peritoneum, if I may say so, and thank you for that. They inserted 2 or 3 catheters through the peritoneum. Then, with those 2 or 3 catheters, I guess I ran out of saliva in my mouth, so my friends are trying to bring me water. From those 2 or 3 catheters in the peritoneum, there were purulent and bloody discharges. In short, by the time we can give a first and last name to Klatskin tumor cases, in other words, by the time we can call it cancer, patients are lost within 3 to 6 months. So, is anyone bothered by this? No, they're not bothered. Because in all the books, it says that Klatskin tumors survive for 3 to 6 months. They only live 3 to 6 months, so doctors were right. Our patient died within 3 to 6 months. So, are the patient's relatives upset? No, they're not. That's what it says in the book. Our patient didn't suffer much, they died. And then, before the patient's bile ducts are opened, before the cancer spreads anywhere, the patient doesn't die from the cancer itself, but from complications. While the doctors are trying to figure out what's going on, the patient dies within 3 to 6 months from jaundice, abscesses, infections, and other complications. This week, we performed 3 surgeries for type 4 classic tumors. It's not stage 4, it's type 4 classification. I thank the cholangiocarcinomas.com page. Even if it's to its detriment, you activated it. And actually, we probably need to talk about these things there a lot more. One of them had a metal stent. The abscesses and so on were really bad. We cleaned them up. Of course, placing a metal stent is very difficult. Then, on top of that, one of them had a plastic stent. There was a case from Denny's Lee, a very high-level staff member, with more than 12 bile ducts reconstructed. It was the most untouched case. It's hard to get more than 12 ducts out in a lifetime. In the world literature, up to now, if there are 40 or 50 patients who have had surgery on 12 ducts, that's about it for cases above 12 ducts. Of course, we probably have around 350 or 400 cases where we've done multiple ducts. But if there are 35 or 40 cases with more than 12 ducts opening outside the mouth, well, since that's our technique anyway, since it's the technique we developed and published, it was published in Annals of Surgical Oncology. That PDF, which we put on our classictumor.com page under my photo as the technique Ünal Aydın brought to classic tumors, can also be viewed there. Our specialists can check it, and professors should take a look too. Then, from there, that case gave us that opportunity. We performed the surgery in a completely pristine and very clean manner. He went back to Denny's Lee in 3 days. We also discharged other, but problematic, patients early. One of our patients had a rhythm problem. He had ventricular extrasystoles for a long time. We said he should stay for more than a day so I could monitor him, but he's still staying today, right? We'll send him home tomorrow as well. But when you look at it, we've done 3 cases today. All 3 are type 4. Where are the type 2s? Where are the type 1s? Where are the type 3s? Where are the type 3 as in BS? They're left to die on the street because some people come and go thinking, I'll operate on this one. That's how it is. Did I get it off my chest or not? That's how I told it. Thank you.
Thank you.